Sex is art, sex is creation, giving indescribably sweet sensations with every friction and penetration. It will never lose its fascination.
So, my first question to you is, for those who are LGBTQ and they like to bottom, what is the safest way for them to clean themselves? The proper and safest way for them to clean themselves out when preparing for sex?
Yes.
So, first things first, you have to know your body. I would definitely say, eating, you have to keep an eye on that if you're trying to prepare. You can't be going to have Taco Bell, Chipotle, Mother Nature all in one day and expect to be having a smooth sailing bottom experience, especially for your first time. So what I would say, if you are deciding to eat those things, just keep your gut clean with fiber. Now on the market, we have a lot of things such as Metamucil, Pure for Men, Pure for Her. So if you're interested in anal and you are a woman, they have that as well. So yeah, starting there, just make sure your diet is well. Second of all, you never want to just jump right into anal. You want to get to know your hole, play with it, use a toy on that, maybe a finger first. And then when you're ready, here comes the time to douche, to clean your anal cavity. So you're gonna buy either a bulb, it's a small little one, that should be your first time. For more experienced people, there is another big red bag you fill up with a hose, and that's for a nice deep gut cleanse if you're trying to go all night the night after. But for starters, you have a bulb douche. You're just trying to clean the first couple inches of your colon, your rectum. And what you do is fill it with water, you pump it up your hole, up your butt, and you release until the water turns clear. And that should take about 3 or 4 rinses. And once you're done, you're ready for action.
It's just best to have everything all cleaned out. You don't have to. It's not going to be harmful for you not to do those things, but to make the experience a little more pleasurable for the partner, it's a pretty good idea to make sure your bottom's cleaned out. Otherwise, then there will be shit. That's the nicest way I could put it. Also, too, and just to keep in mind that your anal tissue, your rectal tissue, is not as pliant as other tissues in your body. So you want to be aware of microscopic tearing. So the best way to keep yourself healthy and infection-free is to use lubricant when you're having sex. The wetter, the better. Just lube is your best friend when it comes to bottoming. And you can get water-based or silicone. Water-based tends to dry out a little more, but you can use it with toys if you're incorporating that in your play. Silicone you can't use with silicone-based toys because it will cause them to disintegrate and you could end up with an infection. And just honestly, this is going to sound very corny, but communication, even if you're just randomly hooking up with someone, it's just really good idea to talk first before you have sex.
As far as douching is concerned, it's just the typical thing of, keep doing it. Use lukewarm water. Don't use hot water. Don't use cold water. Cold water causes cramping. Hot water is just bad for your system because you don't want to necessarily burn the inside of you like that. So so definitely use lukewarm water, because that would be better for the system. And I would say probably should do it over, not be in the bathroom for 2 to 3 hours, but your entire douching process should be over about within 2 to 3 hours, because sometimes when you think you're done, you might have that moment where later on where more that's further up in there comes out. So that's why I would say you probably should be between 2 and 3 hours before you plan to have intercourse. And you can eat you can go out and eat if you plan on bottoming. I would just say because the food doesn't get into the small intestine until about maybe 6 hours. So you can actually eat. That's one thing some bottoms like, they don't eat anything, won't eat anything at all. You actually can. You just make sure it's something that's not going to, go through your system easily, like, let's say, spicy foods. Something like that is something that you want to stay away from. But, regular, healthy eating within that, I would say, 6-hour time frame, you're fine.
Because I did forget to put this in, there is a caveat. You don't want to overdo it with enemas and douching, because you, as a cleanliness practice, it's best to do it a few times a month, which is, I know sounds crazy if you're sexually active, more than that, and if you have a consistent partner, you maybe don't want to be waiting that long in between. But if you overdo it, you're cleansing out healthy bacteria that's in there. Your rectal lining, your rectal tissue is becoming very dry, which means it becomes porous, which means more tearing, actually. So it's best not to repeatedly use an enema or douching days and days and days in a row. You can do once a week, that's good. A couple times a month, also good, but not every day. It is not recommended for everyday use.
And then this is a question I usually ask, especially like other experts and health specialists, but they can't seem to answer it. Same question, only for those who top.
Wow. Same question, only goes to the top. I would say for a top, it's more mental. Probably. Because I think a big problem with a lot of tops that I've encountered is that they are so busy trying to imitate what they see in porn as to what a top is supposed to be, or what the dominance that they're taught in their ethnic culture. They're trying to bring that into the bedroom unnecessarily, and it winds up making them be totally ignorant of what the needs of their bottom is. So I think it's more mental for in regards to top, and I am definitely anti-poppers, which I see a lot of tops and bottoms using it, which also kind of shows how the when they try to pass off poppers as, oh, it makes it easier for a bottom to take dick, yada yada yada. Oh, I always go to the argument, okay, then why are tops doing it? You're doing it to get a high. And I always feel like if the sex itself is not the only high you need, you're doing something wrong. But I would say if some people make for mental, in regards to the top, it might be an enhancement pill might be a good addition for some. And in that case, do not do that plus poppers, because of the fact that that combination together can lower your blood pressure to a dangerous level. So like I said, for top, pretty much it's more mental and emotional at being a good top than anything else.
Okay, so obviously as a top, it's easier to prepare for sex, because all you have to do is get hard and fuck. But, you should also know how to fuck. And that comes with territory such as making sure your bottom is relaxed. You want to give them a massage, foreplay, touching their erogenous zones, such as nipples, the taint, balls, whatever. Or if you're in a hetero couple or, fluid on the spectrum, That's nipples, clitoris, stuff like that. Okay, but you want to really make sure that your bottom is relaxed and comfortable and ready to receive penetration before you go ahead and start sticking your dick in. That being said, you know, some people like their ass eaten. Some people like to eat ass. So that's all a matter of personal preference. What I say, don't yuck anyone's yum. If that's what you like, great. If that's what you don't like, find something you do like and your partner likes and see what works for you guys. Because if you're not relaxed, then it's not going to be fun for the bottom, and then eventually it won't be fun for you because they'll remember painful time.
How the thought of entering a pussy cause a tingle in a man's cock. Then the tingle makes it grow, leading it to get hard as a rock. Or how the same can be incited by anticipation of entering an ass, making him eager to thrust in that orifice, sometimes slow, sometimes fast. He will never lose his fascination.
Can you identify each of the different STIs, and as you mentioned them, what are the symptoms for each of them?
Okay, so the big three in this area, in the Albany, Schenectady, Troy County area, are chlamydia, gonorrhea, and syphilis. So for people that are having sex with women or non-binary people that have vaginas, you can be susceptible to getting chlamydia and gonorrhea. The more partners you have, the easier it is to get chlamydia and gonorrhea. I want to say that, the rates that I've seen are in a single month. If we see 5 patients, at least 2 or 3 of them will have chlamydia or gonorrhea. Women are carriers, or people who have uteruses are carriers for chlamydia and gonorrhea. They will not have symptoms. So there's a strong possibility that they don't know that they have chlamydia or gonorrhea. For men or for people who have penises, there's usually a slight pain in the testicles, pain with urination, possibly some discharge from the penis. Those are the big symptoms that you know something is going on. Sometimes people say, well, I had some pain in my balls and I didn't really think too much of it. It's possible that you are infected, and if the longer you ignore it, the worse it's actually going to be for you, because then that infection can travel up into your lower abdomen. So it's just best, if you think something's wrong, even if they say, oh, we tested you, you're negative, it's just better to be safe and sorry and get tested. Syphilis is one of those STIs that comes and goes really quickly with symptoms, and this is for anybody who's sexually active. Sometimes you get what they call a canker, some people call them chancres, on your genitals, and it's a small bump, and it can be there for 24 hours and then disappear. So sometimes people think that they may have an ingrown hair, or that maybe they had cut themselves, or maybe they even imagined it. That is usually the first symptom, and you can have what they call primary syphilis for a long time before it turns into secondary syphilis, which is much more dangerous because that can affect your liver, and you could end up in the hospital because of it. And then there's tertiary syphilis, which you would have to have for a very, very long time, like over 5 years. You could have syphilis and not know it. That causes blindness. It also eats away at your brain. I've been working in this field since 2007, and I can honestly say I've never met anybody who's had tertiary syphilis, but it does happen. I have seen cases of secondary syphilis. So I always err on the side of caution. If you see something and then it's not there anymore, just better to go to the doctor and get that blood test to see if you have syphilis. So there are the viral STIs, your HPVs and your herpes. So herpes, and also known as herpes simplex 1, that affects your genitals. and HPV, which is the virus that causes genital warts. Those are viral, meaning you have them forever. Something like gonorrhea, chlamydia, and syphilis, those are bacterial. Those you can treat with an antibiotic. For something viral, like herpes and HPV, you can have outbreaks for your entire life. That isn't even necessarily from penetrative sex either. You can get herpes and warts from skin-to-skin contact. So you could be nude and your partner could be nude and you could be rubbing up against each other. You can even get sores in your mouth from herpes, and you can pass it on from kissing. I highly recommend, if you have anything in or around your mouth that should not be there, like a sore or a cut, don't kiss people. That's just the bottom line. You can spread, when you have an active outbreak, you can very, very easily spread herpes and genital warts. People don't necessarily have outbreaks routinely. A lot of times when your body is under stress, you can have an outbreak. If you have a cold or you're just mentally under stress, then that means your white blood cell count goes up, and then that means that your body's on high alert, and you just become more susceptible to having sores on your genitals or in and around your mouth. HPV can lead to cancer. So having a wart isn't necessarily a sign of HPV, but HPV does cause warts. It's sort of a nebulous kind of virus. And we do recommend that people get the Gardasil vaccinations. You can get that as early as age 11, and they go up to age, I think the cap it at age 45. For genital warts, they can be very intrusive, and some people, they get so many that they actually have to have them surgically removed. A lot of times you can take something like a Valtrex and it'll clear up, but some cases when you get what they're called officially as condyloma, but we know them as warts, you can get them internally as well, so they can be in your rectum, in your vulva, and you would have to have them surgically removed. That is covered by health insurance, FYI, but it's just better to, like I said, use lube and or condoms or be on PrEP. Lube all on its own protects you from STIs by up to 35%, which isn't great, but it's a lot better than 0% and possibly having HPV and herpes for the rest of your life. So HIV can vary. If you have an acute infection, that means that from the time that you were exposed to the virus to it actually being in your body, you could feel fatigued even after sleeping for 8 hours. You're still feeling like you're not getting enough sleep. You could have what feels like a low-grade fever, meaning that your temperature is somewhere between 99 and 100 degrees, which is it's not, sorry, I'm having trouble talking. It's between 99 and 100 degrees. That's what they consider a low-grade fever. And it will come and go. You may not be feverish for days on end. You could have it for a few days and then have it stop, which is why it's very difficult to pin down if someone is HIV positive with these very vague symptoms. Some people feel like they get the flu, and again, they feel sick for a few days, they feel tired and worn out, have some slight aches in their joints, and then they'll feel better, and then it comes back again. A lot of times, most of the time I should say, that someone will not have any symptoms for HIV. A lot of people that come in and get tested, they'll say, oh, I have this really strange mark on my shoulder, and I know that that's one of the symptoms of HIV. That's not true. That's Kaposi sarcoma, and that is skin cancer, and that is basically is what happens when you have end stage of the HIV virus. you may not necessarily know you have it, which is why it's so important to get tested, especially if you're sexually active. You should get tested at least every 3 months. If not, even getting tested every year is good. Seeing your partner's HIV status, also very important. If you have it and you're giving it to people, most times it's because you don't know you're HIV positive and you have been having sex unprotected with multiple partners, then they get it. It's the old saying, if you have sex with someone, you're basically getting into bed with every person that you've had sex with. It's just important to know your sexual network. Again, no judgment. If having sex with multiple partners is your lifestyle and that's what you feel comfortable with, that's great, just as long as you keep yourself healthy and you know your status and you know your partner's status.
What is the difference between HIV and AIDS?
That's a great question, actually, and we should keep asking it because people can often conflate the two. HIV stands for human immunovirus. So basically, the HIV virus enters into your body and it attacks your white blood cells. Your white blood cells are the feature in your body that keep out bacteria, viruses, and the virus comes in and they call it a lock and key disease, meaning that it mutates to take on the shape of whatever white blood cell looks like. So it holds on to it and it basically makes you immunocompromised, meaning you have no natural defense against any type of virus or bacteria. So for people who are not taking their medication and they're HIV positive, someone who has a cold could get them very sick and they could end up hospitalized. They can end up with tuberculosis. They could end up with certain type of pneumonias, stop breathing and die, unfortunately. If you have HIV and you get into treatment immediately, you will never progress to what they call having a CDC diagnosed AIDS, CDC AIDS diagnosis. The AIDS virus is a blood-borne pathogen, meaning that it's spread from blood-to-blood contact. It is in semen and in vaginal fluids. It cannot live outside the body. It dies once it hits the air. It is not spread through saliva. It is not spread through tears. You cannot even get HIV through oral sex. So it has to be penetrative sex, penis to anus, penis to vagina. Someone who has CDC diagnosed AIDS, that means that they have a large amount of virus in their body. Someone who has HIV and they're considered what they call well-controlled, meaning they go to the doctor, they take their pills every day. That means that the amount of virus they have in their body is so small, they call it undetectable. That means they have less than 20 counts of the HIV virus in their body. So someone who has the AIDS-defined variant, that means that they have a large amount of virus. We're talking about millions in their system. What also classifies as an AIDS diagnosis is that your CD4 count, your CD4 cells are the ones that fight off colds, viruses, bacteria, etc. If that is less than 200 count, that means that you are considered having an AIDS diagnosis. Even if you make a full recovery and you're taking your medication to go to the doctor, you're still considered having AIDS, even if you have a high amount of CD4 in your body. An average person who does not have HIV, their CD4 count will be in the millions. Someone who has HIV and it's well controlled, a good CD4 count for them would be between 500 to 900. Someone who is considered as having AIDS, it would be below 200. And I've seen some people with CD4 counts that were 17. I even remember someone who had CD4 count of 5. They had 5 whole cells in their body that were trying to fight off viruses, germs, what have you.
How the thought of being entered or stroked makes a woman's pussy wet. So her party has an easy glide and both pray for no regrets. Her orgasms are reached by simple back and forth motions, bringing life by the end or spirit when eggs and sperm meet in our oceans. It will never lose its fascination.
So, when it comes to treatment for HIV, what is the current treatment that is available for folks once they, actually let's back it up.
Okay.
What is the process of them, like, how do they get tested? Once they get a positive test, what is the next step for them?
Okay. So you've had your confirmatory. They say, yes, you definitely are HIV positive. You are then asked to go to the Department of Health. For each county, the Department of Health actually has an active list of people that are HIV positive, and that is to ensure that they're going into care. For folks that are not in care, again, if they're not on medication, they have a large amount of the virus in their body. They can easily spread it to other people. So if you find out you're HIV positive, you can meet with the Department of Health and they can set up an active referral, meaning they will call or take you over to a clinic to get you an initial appointment. The standard now is to get someone treatment as soon as they walk through the door. So it is quite a lengthy appointment. So it is basically like having a yearly checkup with more blood work and testing and other STI testing involved. But you can get treatment within 24 to 48 hours of seeing your doctor from your first visit. And the great thing about it is that with HIV, we know so much more about it now. They have a lot new drugs that you only have to take 1 pill once a day. And the side effects are generally minimal, meaning when you first start it, you might have a headache or you might have nausea or diarrhea. HIV medications can be a little harsh on the gut, so we always recommend patients take your pills with a meal or take it before you go to bed. Your side effects of the medication generally don't last more than 5 to 7 days. If you're still feeling really, really sick from taking the medication, meaning that you're throwing up and it's happening every time you take your medication, then that's a good time to call your doctor to get you on a different regimen. And there's so many different classes of drugs now, and they're all covered by health insurance. And even if you have private health insurance, you're not on Medicare or Medicaid, there are programs, the drug manufacturers will give you copay assistance, and that can be up to $7,200 a year they can cover. Because most HIV meds are very expensive, there's no generic equivalents. So that means that the insurance companies can charge the highest rates. So a copay could be $500 a month, it could be $25 a month.
That's cool. Now, from my understanding, you guys also will do a test that will determine which medication people might be resistant to.
Yep.
How does that work?
So it is literally just called a drug resistance test. For someone who is treatment naive, meaning they've never been on any kind of HIV medication before and they're newly diagnosed, that would show up with which class of drugs this person could not take. Meaning they could be prescribed this medication and it is not doing anything to reduce the amount of HIV in their system. It is not doing anything to boost their immune system. So they usually run, the provider, if they're good, they will run a resistance test on any patient they get that is new to their practice or new to treatment. Drug resistance testing is done a lot for patients who are not consistent with taking their medication every day that are HIV positive, it is far actually in terms of speaking about effectiveness of medication. If you're taking your HIV medication here and there, you're not taking it consistently, you're just taking it whenever, you're actually at greater risk of becoming resistant to so many classes of drugs. And then you might be put on a regimen that they haven't given somebody in a really long time. You could be taking 2 or 3 different types of medication and taking possibly any combination of amount of pills. You could be taking a medication that's 3 pills in the afternoon and then 2 in the evening in combination with other medications. So for someone who is HIV positive and they're not taking their medication at all, they might not actually be drug resistant to anything. So thankfully in New York State, you can get treatment for chlamydia, gonorrhea, and syphilis very easily, low barriers. You can go to, if you have a positive test and you're not able to get back to the provider that you saw, or you have privacy concerns, you can go to your county Department of Health. They have a sexual health clinic once or twice a week, and you can get the treatment for free. For chlamydia, it's an antibiotic. It's 2 pills that you take, and that's it. You take the 2 pills at the same time, and you have to be abstinent for 3 to 5 days afterwards. You have to make sure that any partner you have, you either tell them you have chlamydia and you're in treatment for it, or if they know they also have chlamydia, that they need to get treated as well. It's not like a cold. You will keep passing the infection back and forth to each other if you're not both treated at the same time. The great thing about where we live is that if you tell your provider or whomever you're seeing to get your antibiotics, you can say, I have 3 partners, and then they can add ×2 on your prescription so that you are getting the antibiotics and that your other partners are also getting the treatment as well. Gonorrhea and syphilis, that treatment is an injection. And again, you can go, as long as you show that you have a positive test, you can get treated at any sexual health clinic or your provider's office. And that injection is usually given in your butt cheek. The one for syphilis, I will tell you, is slightly painful just because the needle is larger. Yes. Again, once you have the injection, you want to be abstinent 3 to 5 days after getting the treatment. And unfortunately, because it is a liquid antibiotic that needs to be given in a syringe, that you cannot get partner treatment for. But let someone know that, yes, I'm in the process of getting treated for gonorrhea. Do you have it? You may have been exposed, you need to get treated. Sometimes people can even get treated prophylactically, meaning that they'll get the treatment even before the test results come back, because either they were symptomatic or they said, my partner showed me their test results. They said they were positive for syphilis. So you're eligible to get the antibiotic treatment for syphilis based off of that. So the treatment for herpes is valcyclovir that will suppress the breakout that you're having. And you cannot be sexually active while you have an active outbreak of sores or blisters.
How 2 body parts of different genders can be called by different names, but the erogenous function claim turns out pretty much the same. Or how one can inspire an imagination, then the need for masturbation, how a baby orgasm and ejaculation leads to intense sexual frustration. He will never lose his fascination.
I want to get to talk about, because I don't know, I don't think I've come across it, because you have a lot of it, but I haven't come across one where you talked about your time as an adult entertainer. So, what got you into being an adult entertainer, and what was for those who don't know, what was the name you went under?
Oh, well, the first name was changed. The last name is, the pronunciation is Trey Xavier. The last name is spelled the same as the last name I'm using now. The last name I'm using now, however, is the Spanish pronunciation. So Xavier is the Americanized version of that. And a lot of porn studios, of course, did not know how to write the word Trey the way I spelled it, because I spelled it with the accent over the E. And so when some of them would try to call themselves putting the accent over the E, they actually wound up putting just an apostrophe after the E, instead of going to, like, let's say, like, character map and figuring out exactly what to do. But what got me into it, I've always had a interest in doing it, and at one point I was actually looking to be a mainstream performer, actually, and at the same time, so I just decided to put my name out there, because I didn't have a mainstream career at the moment or anything. I decided to put my name out there and see which between the two took off more during that time. Excuse me. And at the time, it wound up being more so my porn career. My first gig was actually my very first porn gig was actually one day after my 34th birthday. I did a solo show on a website that was called showguys.com. And the way I got that gig is I saw an ad in the back of a gay nightlife magazine that I forgot which one. It might have been HX or Next. Those were the two big gay nightlife magazines that were here at the time. I saw that, sent in my picture. My pictures back then, some of them were taken with an actual camera, but while others were actually from my flip phone back then. Mind you, we're talking about like 2005. So if you recall with the way pictures looked back then on your phone, they always had a little grainy and had that blue hue over them back then. So that was what I had sent in to be called. Guy called me up. I went to his apartment. He put on some porn. I got an erection. He scheduled me for the show. And that's how it started from there. And after that, I started, sending my name out to various, studios. But unfortunately, the only studios that really was took interest in me was ethnic porn studio that was called Tyson Kane Videos. All the other studios, of course, if anyone looks back on what porn was like back then, there was no black male being a bottom, especially in interracial scenes, which is kind of why I got into the industry, because I also wanted to do that representation, because that was more reflective of what my personal life was like. Especially during by that time I did porn, I was becoming more versatile in my personal life. But when I first came out, first 2 years out and sexually active, I was a total bottom. And most of my sex partners and people I date were, white or, light-skinned Latinos or whatever. So that was more reflective of what my real sex life was like. But the porn studios probably did not want a black guy being a bottom back then. So I always say that the reason you're probably seeing more black bottoms now in interracial scenes is probably because of my complaining. Two things: me complaining about it and bringing it to their attention, and the recession making them thinking that they had to do something new. Because I'm sure porn sales, especially gay porn sales, since they've always been overpriced compared to straight porn, they felt they needed to do something new in order to up their numbers. So I think that's when you started to see black guys bottoming in gay porn. So I say there would be no Adrian Hart presently bottoming in gay porn if it wasn't for Trey Xavier complaining.
For sex is art, sex is creation, giving indescribably sweet sensations with every friction, penetration. It will never lose its fascination. Sex being love, sex being lust. You're giving into a moment of trust, born in truth or imagination. It will never lose its fascination.
Are you talking about The Risky Dark? It was a story?
It was a story. So there's an audio and there's an actual, like, you were performing it. There's an actual video of you performing it. I cannot remember his name. It's like,
oh my gosh, I'm trying to remember now. I'm trying to remember.
he's Latin, obviously. I think he's from the Bronx or something like that.
I remember now.
Is it Fabian?
Fabian Gotti.
Yes.
Fabian.
But it doesn't have to be about him, but something like of that nature.
That one. Oh yeah, that's that story.
But it doesn't have to be about him. It could be anything of that nature. Something that was exciting. Like I said, this is a sex positive one, so you know.
No, he's a very good memory from my porn career because he was I always say he's the best sex I ever had on camera. I don't know what it was because we did not say very much to each other. There was just obviously something between me and him that just definitely clicked. And so he's topping me and the director said, and cut, and he's still in me. He's still in me, just going back and forth, not at full, speed like for the camera, but he was still going at it. And I was like, oh, and for me, I felt like when the director said and cut, I was like, I totally forgot the director was even there. That's how into it I got. When the director said and cut, man. So yeah, he's definitely a very good memory. I always look back on him as one of my best, the best sex I ever had on camera. I would say the best evolution of culmination of a scene had to be one of my last scenes of one of my probably my least known videos called All Out Assault, because another black guy actually. The thing is, the way me and him got together, everything worked out the way that I entered the industry thinking that it was supposed to be like. Because we saw each other back when they had the Gay Erotic Expo. I saw him there. And I kind of got the energy from, we've talked about the fact that, we go by energy. And I kind of got the impression that he was into me just as I was into him the second we looked at each other, because he was working for a totally different company. And so when we started, when I just asked for his to buy a DVD from the company he was representing. And then, but there was another vendor the person whose porn was just starting a porn company. I talked to him, we exchanged info, and when I wrote a blog entry about my experience at that Gay Erotic Expo, I mentioned that guy because that guy was the only photo I took of the Gay Erotic Expo that year that I went, because it was then a point where I was considering leaving the industry. So when I was like, okay, once I talked to that guy who started a company, and he saw the article and I mentioned, he's like, yeah, I talked to that guy and we're actually thinking about doing, doing a scene. And I was like, oh, so that's how me and him got paired. So for once it was a mutual, pairing, instead of some studio saying, okay, here, we're gonna pair you with this person, and boom. It wasn't like that like I've had in the past. So it was actually someone who I chose him, he chose me, which is why if you ever see one of the little clips or GIF that I may post on my social media, you'll see why it works so well.
You brought this up in some of your articles. When it comes to as you call it, sexpectations and such amongst the queer community. Do you feel that porn has had a negative effect on how we look at sex and navigate sexual encounters and such?
Do I feel porn has had a negative impact? Most definitely. It's one of the things that that's one of the things besides me getting tired, me probably getting blacklisted because I was so vocal about what's wrong within the industry. Another part was I just got tired of fighting and saying, we shouldn't be showing, porn studio shouldn't be showing this and you shouldn't be showing that. Like back then, the things I was being most vocal about while I was in the industry was the fact that they were using gay for pay porn actors. They're still doing that. They're just not referring to them as that right now. Because I actually wrote an article in where I realized that there was a string of violence in these gay for pay porn actors, because there was repeated news stories about gay porn actors getting arrested for beating up someone who was probably smaller than them or weaker than them in some kind of way. And then I realized there was a string. It was all gay for pay porn actors. And I was like, it must be that denial of themselves causing this inner rage, because I was thinking back to myself before I came out. My temper was off the charts back then. And so I realized, I'm like, yeah, they may be, having an outlet that I wouldn't have had, but look at what they're becoming. So back then it was the gay for pay thing, but now it's like what's being validated through porn is, chasing after being an older gay male and chasing after, guys who look young enough to be in like junior high school now, like with some of these websites. The whole incest porn with the stepbrother and stepfather and all that stuff. All those things, and they will be so quick to try to monetize it and make an excuse for it. They'll just say, oh, that's a fantasy. No, that's not a fantasy, that's depravity. There's a difference between, healthy sexual encounters put in front of a camera and outright depravity. And that's what that is. And that's why I didn't want any part of that anymore. So that was the other half of how I wound up leaving the industry.
So let's talk about the apps and such. Grindr, Jack, was it Adam for Adam, and a bunch of the other ones.
Scruff.
Yes. All those stuff. What it was initially used for, or what it was supposed to be for, to the negative, what it's become now, and it's such toxicness. Let's talk about that. Let's touch on that, and especially when it comes to race amongst us.
Oh yeah. Yeah, the only people that seem to have any good Grindr stories, I guess you could say, are usually white males and white and light-skinned Latin males. And that's why in a lot of people in my writings, when I say, when I talk about racism in the gay community, I always wind up referring to, white or light-skinned people of color. The color is, people would probably think, oh, you must hate light-skinned people too. I'm like, no, that's not it. They've jumped on this bandwagon. A lot of them, not all, but a lot of them have jumped on this bandwagon to gain acceptance by racist whites by using colorism as their ticket in, because colorism now is the new cover that people are using for racism. So they're just jumping on that, and I see that behavior happening, and so that's where the real problem comes in with that. And yes, it is a very toxic environment where, and one thing I get so annoyed with is how many times I get hit up, because I do have a grinder, where I get hit up by so many people who just want to give me like a body part, be like, hi, and you actually expect me to respond to you. It's once again upping the ante of something negative, because it's still that lack of intimacy. They don't seem to get in their head that part of me getting to know you, even for a one night stand, I need to see your face. You know, I don't need to just see just a dick. I mean, nothing on my profile even says that I want to be a cum dump, or that or the part of me wants, when I want to top, that I just want a hole. I mean, you should still want something. And I also see a number of so many profiles that say, you know, no face pic, no chat. So I'm wondering why these people still sending these pictures out where it's just a body part. But it seems to have upped the ante more over the years than I would say back in the day when online. Like I said, back in the day online, it was manhunt was the big thing that you had online. But now that's what it seems like they're doing it, just the body part more so, and you know, and nothing else. And as far as race relations concerned, I think now what's happening is that they don't say anything because they realize that it's become more publicized about the racism that is, you know, executed through these apps. So they've gotten to the point where they just basically just don't respond anymore. They, you know, you may hit them up, but they don't say anything. So I mean, if that's the case, fine. But I find it real funny, and I did write about this at one point where, because I grew up, born and raised in Bed-Stuy, Brooklyn, which in my years of growing up, before I would say about 2005, was a predominantly black neighborhood. So now you have all these, you know, white guys in the neighborhood who only want white guys. I actually have seen profiles where it says white guys only. I'm like, you got the nerve to come into my neighborhood that was black decades before you got here and only want white guys? Go back to wherever the hell you came from then. But yeah, that's the attitude that's really going on out there now. And I always say, that's why I tend to, when I go out, I sometimes can get a vibe from the older gay white men out there who hit on me, where I feel like when you get that energy sometimes of this arrogance coming from them, where I feel like in their heyday of being young and pretty, that they were acting just like these guys, minus these apps to execute it. One thing I don't do, I would admit that I can be very adventurous, and throw myself into situations that I probably shouldn't, because I'm always trying to figure out, I was like, what's the draw? I mean, I've experimented with drugs for that, because that very same thing. I'm always wondering, what's the draw to this whole thing? And one thing that I do not recommend people do is to go to people's homes, because especially as it gets worse and worse, and there are many guys who are on the down low who won't necessarily say they're on the down low, and if you're going to their apartment, you're putting yourself at risk. So if you were going to meet someone who's online, I would always recommend meeting someone in a public space. and having it, and not just letting it be that you meet in that public space and then you're off. No, have a conversation, to read body language and all that, read the body language, read their eyes, read all that stuff before you go anywhere with that person, whether it's your place or theirs. Because that's really one of the main dangers of meeting online is. I mean, even myself, not even online. The night, like I said, when I lost my virginity, I was kind of concerned for myself, and I met those people right there in the bar. So if I can have that concern about people who I met right there face to face, people should definitely be more vigilant in meeting someone who they have never laid eyes on before in person.
Now, when we look at sex education, stuff like this, why is it that, or can you give an insight on why, one, in schools, I think they took it out recently, but why don't they talk more about this, especially especially when they not gearing it towards that of LGBTQ folks?
Each school can make up their own curriculum. There is a New York State core curriculum that they have in regards to talking to kids about sexual health, and it's usually the basics, and it is geared for people who are heterosexual and cisgender. So you're excluding an entire group of students who don't fit into that category. As far as I know, like I said, each school, it's up to them to decide how they want to give out that information and who they're giving it to and who should teach it. Sometimes Planned Parenthood will come into certain schools. I know they're more active on college campuses where the curriculum is a lot more lenient. School board has a lot to do with how that information is disseminated and who is receiving it. But yes, basically you're excluding queer kids, people who don't identify as either, who are non-binary, excuse me. And then that forces that group of kids to find their information elsewhere, either through older friends, through older family members, going to Google, going to porn sites, just to even learn the basic mechanics of how they want to have sex. And as most people know, porn sex is not like the sex that you have in real life. So then you're creating this myth that you're not going to live up to, or there's a lot of good things about pornography, but then it depends on also what site you're looking at, because there's also a darker side to pornography. Are people in it that are being abused? Was it consensual? And those are just general things you should think of when you're entering into a sexual relationship at a young age anyway. Is it consensual? But yeah, you can get a lot of misinformation and get the wrong idea about having sex, what it means to you, what it looks like.
Sex will never lose its fascination.